clinical question that we set out to address here is that patients have heterogeneous outcomes after bone marrow transplantation. Some people have their leukemia remitted and they go on and they have long-term survival without graft versus host disease. And other patients succumb or suffer from graft versus host disease very early on. And because the intestinal microbiota is understood to be important for the pathophysiology of GVHD, the overall goal here is to understand how are the gut microbes interacting with the donor immune system in a clinical setting of a transplant patient. We collected stool samples from patients undergoing bone marrow transplantation. We aimed for at least weekly sampling, and we assembled a biobank of over 8,000 samples from these 1,300 patients. This is the largest cohort of its kind that's been assembled in the transplant setting. The key outcomes that we demonstrated in this study are that patients with a healthy gut, as assessed by high alpha diversity, pre-transplant, go on to have a longer overall survival. And patients with an injured gut, as assessed by low diversity, have shorter overall survival. And this was driven by transplant-related mortality. The conclusion is that we have to consider the gut microbiome as an integral organ in the patients that has an important association in humans and an effect in mice on outcomes post-transplantation. Ultimately, we'd like to, A, predict what outcomes are going to be, because that might inform other treatment decisions, such as the intensity of GVHD prophylaxis, and B, even better, intervene directly at the microbiome level in a preventative or a remediation approach.